often deal with the issue of your experience.
Mm-hmm.
You say that you've only been in Washington a few years, but you've been there long enough to know that Washington needs to change.
Right.
Your critics say that you're, I guess in a spin on that you're long on style and short on substance. How do you answer that?
Well, I think that if you look at my track record as a state legislator, if you look at what I've accomplished over a relatively short period of time in Washington, I think generally people would say this guy has a body of work, both on domestic issues like providing health insurance to children, on international issues like dealing with the proliferations of weapons that can fall in the hands of terrorists, that match up very well with the other candidates. And one of the things that I think people have to recognize is that we've ramped up from 0 to 60 in this campaign. We can't do everything all at once. Mm-hmm. We feel extraordinarily good about how the campaign has unfolded and the outreach that we've done to Americans and the degree to which they've been inspired to see this campaign as a vehicle for their hopes and dreams. Mm-hmm. And it's going to be a long campaign. So by January, if people were making these same criticisms, then I think we'd be concerned. When it's 8 weeks after I've announced, I feel pretty confident that as people get more information about what I've done in the Senate, what I've done in the state legislature, what we're proposing in terms of moving forward on healthcare, energy, education, the other issues that are of importance to the American people, that they'll feel confident that we've got an agenda that matches up with what the American people are looking for.
Let's talk about healthcare. As I understand it, you're going to trot out the details of the healthcare
Right.
plan next week.
Right.
Tell me what you can about it.
Well, look, a couple of principles. Number one, I think that when we're spending $2 trillion every year on healthcare in this country, there's no reason why we shouldn't be able to create a system in which everybody's got basic coverage that is affordable and accessible. Number two, we're going to have to save money in the existing system. We've got to rationalize and improve how we spend our current dollars in order to bring more people into coverage. That's done by providing more preventive care, making sure that those who have chronic illnesses like diabetes are getting adequate care, implementing medical technology, and helping hospitals and rural communities and the inner city that may not have the resources to move towards electronic medical records that will improve quality and cut costs. Take those savings and then make sure that those savings are used so that people who don't have health insurance or are underinsured have access. How we set up the system for the uninsured or the underinsured, I think, is something that we are going to be unfolding over the next couple of months. We know that it's going to involve pooling of risk, allowing people either to buy into a federal system that already exists and I benefit from, or some model like what Massachusetts and California is doing, in which states are setting up a series of pools that people can buy into so that small businesses, individuals who right now don't get the benefits of scale are able to join a larger pool, save money, reduce premiums, reduce co-payments, reduce deductibles. So that's going to be the general direction that we're moving in. And I think that what you'll see by the time that we're actually in the fall or running up to the Iowa caucus is that all the candidates will have a plan. It'll be variations on one of those approaches that I just discussed. The question then is going to be who's able to mobilize the country and voters and get them excited and convinced that, number one, we elect a Congress that is bought into a plan, and number two, that the president can bring together various diverse parties who are going to be committed to making this happen relatively quickly.
Can you do it without a tax increase?
Well, I think that what we have to do is examine how much money can be saved by making the system smarter, and then determining what additional resources do we need. I'm committed to making sure that we find those resources. It is possible that we're going to need additional resources, at least on the front end, particularly if, as I mentioned before, you've got some transition costs that are going to be involved for things like implementing electronic medical records. I think you save that money on the back end. And so what my commitment has been is that we will do what it takes to make sure this happens.
Forgive me in advance.
Please.
I'm silly questions.
Go ahead.
Take about a minute.
Yeah.
Favorite reality show?
Other than the U.S. Senate on C-SPAN? Yeah, I don't watch them too often.
Latest music purchase?
Latest music purchase would be, I'm trying to think of what is the last CD that I bought. Probably Ray, the soundtrack from the Ray Charles movie.
What kind of car do you drive?
Chrysler 300C.
Favorite electronic gadget?
Have to be my BlackBerry.
Hidden
Least favorite, BlackBerry.
Hidden talent?
Pretty good poker player.
Home tasks that are wanting because of this?
Too numerous to list.
And if you were on a desert island, what would you have to have?
If I were in a desert island, other than my wife,
Yeah.
my kids. An inanimate object that I would have to have, it would probably be a good book.
Okay. I apologize.
Nothing wrong with that. That's what people. That's the only part that people are going to read.
Thank you, Senator.
Good to see you. Thank you so much.
Thanks.
Thank you. Appreciate you.